one group is escitalopram group, another group is amitriptyline group. This escitalopram is a selective serotonin reuptake inhibitor and amitriptyline is a tricyclic antidepressant. After that, I compared the efficacy of escitalopram and amitriptyline in reducing suicidal risk. Materials. This study was conducted in Wills Vijayanagaram and Errata Mental Hospital, Hyderabad. In my study, total patients were 60 patients. Among 30 patients were kept under escitalopram group and another 30 patients were kept under amitriptyline group. This is a prospective parallel simple randomized study and conducted from December 2011 to June 2012. In my selection criteria, in inclusion criteria, patients of both sexes between 20 to 60 years and who are diagnosed with moderate to severe depression with HAM-D, that is Hamilton Depression scoring between 13 to 28, and patients who are diagnosed with suicidal risk with Beck's suicidal intent scale between 18 to 40, patients who are willing to give written informed consent. In exclusion criteria, patients who are suffering with schizophrenia, bipolar disorder, drug abuse, and already on antidepressant treatment and severe cardiovascular diseases. Method of the study: patients attending to OPD of Psychiatry Department of MIMS and Errata Mental Hospital, Hyderabad were screened for selection criteria after obtaining written informed consent. After fulfilling the selection criteria, patients were randomized into two groups. In under group 1, amitriptyline 50 mg 2 times daily for 6 weeks, and the group 2 were on tablet escitalopram 10 mg 2 times daily for 6 weeks. After 6 weeks, HAM-D and DSIS scoring were repeated for data analysis. In between these 6 weeks, patients were clinically assessed and examined on weekly basis and advised to report to the hospital immediately if any adverse drug reactions occur. This is a HAM-D scale. This is used for a depression assessment that is categorized into normal, mild depression, moderate depression, very severe depression, and very severe depression. Among this, this is a 21-item scale. Among this, there are sub-responses. This is a Beck's suicidal intent scale that is used for suicidal risk. This is a 15-item scale. Among 15-item scale, there are 2 to 3 responses. And if it is the patient is a low intent, that is total score is 15 to 19, medium intent 20 to 28. If the patient is high intent, that is more than 29. My results: after giving up amitriptyline, there is reduction of depression as well as in suicidal risk. And p-value is 0.001. And the here test was done. That is a student T test. And by giving escitalopram also there is decrease in suicidal risk and as well as depression after giving this escitalopram for 6 weeks. The p-value is less than 0.001. When after that, after comparison between these two groups, escitalopram and amitriptyline group, both groups are decreasing depression as well as suicidal risk. But comparatively, escitalopram had a good efficacy on amitriptyline. Discussion: studies of Eravanian, Pedersen, Wolfans meta-analysis conducted by Stone et al. Were reported that decrease in suicidal rate correlates with increased antidepressant. Our results are in agreement with these studies. Hence, escitalopram and amitriptyline are significantly decreased suicidal risk in depression patients, and escitalopram had better efficacy than amitriptyline. Limitation: there is no control and placebo group because of ethical issues. And my conclusion is, in this study, after taking escitalopram and amitriptyline, reduces suicidal risk in depression patients when compared to before treatment. Escitalopram had better efficacy than amitriptyline, but this study sample size is less and less studies were done in India, so further studies can be done in large population in future. Thank you.